We are back answering your ACA Marketplace and Medicare questions. Dr. Catherine Sevier, president of AARP North Carolina, Morgan Campbell from Alliance Insurance Services, and Laura Packard from GetAmericaCovered.org are with us answering your questions. All right, this question is, I'm already signed up in the Marketplace. Can I or should I try and go back for a lower rate? Morgan.
You can, if you have a better idea of your income and what it's going to be looking like for 2021. However, what we always want to caution is if you already have a plan and you've started meeting part of that deductible and out-of-pocket max, if we get you a new plan, you go back to zero.
You go back to zero if you change and you already paid your deductible. But if you haven't paid anything on a deductible, it's a wash and it's fine.
That's correct.
Okay, so the deadline to sign up for the new enrollment period is May the 15th. And while you may think, okay, I need to get on this now, Laura, you say some folks might benefit to wait until after they do their taxes. Tell me why.
Well, first of all, there's legislation moving in Congress that may change the amount of subsidies that you get. And second, it may be helpful to have already done your taxes and know exactly how much income you had last year and be able to figure out your income for this year. So that also will help you in figuring out what you qualify for. So it's good to get health insurance as soon as you possibly can. But if you need to wait a couple weeks to get your taxes in order, that's okay too.
All right, Catherine, this person says, I was told by Social Security that I do not have to sign up for Medicare when I turn 65, as long as I still have medical insurance through my employer. Is this true? Let's clarify it again.
I gasp every time I hear that. If you don't meet the time period 3 months before your 65th birthday, 3 months after, and you don't sign up, you will pay a penalty on Part B for the rest of your life. You can waive, but you must complete the full application period program, or you put yourself at real risk.
Okay. This person is saying, can I cancel my current insurance I got and get something new now? And the short answer is yes.
Yes.
Okay, and is there anything, it doesn't matter whether they go with a totally different plan or different company or whatever?
Right. We're open to basically 2.0 all over again. You get a redo right now. So if you don't have insurance, if you need insurance, this is the time to make those changes.
All right, this person says, can you switch to the ACA insurance if you feel like the benefits from your work insurance are not what you expected? Laura?
Well, you can, but if you have qualified health insurance through your employer, you won't qualify for tax credits. So it's worth some research and talking to somebody like Morgan to figure out if that's really the best choice for you.
Okay. So this person is saying, would you be eligible for ACA if you are not working and receiving unemployment benefits? Morgan?
As long as we're meeting the threshold incomes, yes, absolutely.
Okay. Catherine, this person says, why is there a penalty for not signing up for Medicare?
Because there is.
Because there is.
I wish I had a better answer for you, but the government wants you to be a healthy Medicare recipient for as long as possible, and so they really urge you to get started with it at 65. Get your primary care done.
Now, the follow-up question to that is, do you have a choice on which insurance is your primary, Medicare or private?
That depends on whether your employer's insurance is able to pay as a secondary. And what you need to look at then is what the best benefit is for you between Medicare and a secondary insurance. And if you choose your current insurance over Medicare, make sure you sign all the waivers, because again, you missed that Part B sign up and it will be your gift for the rest of your life.
And I think we do have a graphic that talks about the different kinds of Medicare so that we can kind of clarify that. Part A covers inpatient hospital stays. Part B is the premium to pay and covers doctor visits. And Part D covers prescriptions. So we're being asked several different kinds of questions about Medicare when it comes to that. Like, can people enroll in more than one? What do they need to have right off the bat?
So people are automatically at 65 enrolled in Part A. That's what you pay in through your employer, the part that you don't pay. Part B is the one we've talked about several times, where that's the doctor's office, the x-rays, the outpatient stuff. There is now something called Part C, which is Medicare Advantage. So think about a health maintenance organization, an HMO, or a combined, all of your things being paid for in a network. Part D is prescription drugs. If you do Part C, that's all you need. You don't need a prescription drug plan. And they treat it as if, but you're paying for it as if you're paying for Part B because your Part B is rolled in there.
And this is why it is so complicated. You just explain it sounds clear, and yet at the same time, it is complicated. Now, you say SHIP is one of the best places for people to go to have questions answered.
It is clearly one of the best places. And those folks wake up thinking about this every day and know all the little tiny things that you and I don't want to remember about that.
Right. Okay. And so what we've done, we've put the resources for SHIP in our Two Wants to Know story that is already published for you right now so that you'll be able to find that. We're going to take a quick break and we'll be back with our last segment.